It's Miss T here with part 2 of your Healthy Tea segment regarding herpes. Now, there are still some aspects that are not widely known. One could be asymptomatic shedding. So, even when someone is not experiencing an outbreak, the virus can still be shed from their skin and potentially transmitted to others. This phenomenon, known as asymptomatic shedding, highlights the importance of practicing safe intercourse and using protection consistently. Now, there are two types of herpes that we need to discuss: HSV1 and HSV2. While HSV1 is typically associated with oral herpes known as cold sores, it can cause genital herpes through oral genital contact. Conversely, HSV2, primarily associated with genital herpes, can be transmitted orally. The stigma surrounding herpes can have a significant impact on an individual's mental health and well-being. Many people experience feelings of shame, anxiety, depression, low self-esteem as a result of their herpes diagnoses. Seeking support from healthcare professionals, counselors, or support groups can be beneficial for coping with these emotional challenges. Now, let's talk about potential complications. While herpes outbreaks are generally mild and self-limiting, complications can arise in some cases. These complications may include herpes encephalitis, which is inflammation of the brain, meningitis, which is inflammation of the lining of the brain and spinal cord, and neonatal herpes, which is herpes infections in newborns. Herpes and HIV. Herpes infections can increase the risk of acquiring and transmitting HIV, the virus that causes AIDS. This is because herpes can cause breaks in the skin or mucous membranes, which can facilitate the entry of HIV into the body. Additionally, HIV-positive individuals with herpes may experience more frequent and severe outbreaks. Understanding the lesser known aspects of herpes can contribute to a more comprehensive understanding of the virus and its impacts on individuals and public health. Now, let's talk about the several treatments that are out there or options that are available for one to manage the herpes infection. It's important to realize that treatment can aim to alleviate symptoms, reduce the frequency and severity of outbreaks, and to minimize the risk of transmitting the virus to others. Now, let's talk about antiviral medications. Prescription antiviral medications like acyclovir, valacyclovir, and famciclovir, which are commonly used to treat herpes outbreaks. These medications work by inhibiting the replication of the herpes virus, thereby reducing the duration, the severity of the symptoms. They can also be taken as suppressive therapies to prevent outbreaks from occurring or to reduce their frequency. There's topical treatments that one can purchase, like over-the-counter, such as creams or ointments, gels containing antiviral agents. That can relieve like symptoms like pain or itching, tingling, anything associated with the outbreak. These treatments are applied directly to the affected area. You can get like pain relievers like ibuprofens or acetaminophen, which is like Tylenol, that can help alleviate the discomfort associated with the herpes outbreaks, that can help with your pain, fever, or your headaches. Now, antiviral suppressive therapy, like for individuals who experience frequent or severe herpes outbreaks, doctors may recommend long-term suppressive therapy with antiviral medications. This involves taking daily medication to reduce the frequency of the outbreak and to decrease the risk of transmitting the virus to your partners. Now, you can do like education and counseling. Healthcare providers may offer education and counseling to individuals diagnosed with herpes to help them understand the virus. to manage the outbreaks, to reduce the transmission risk, and to cope with the emotional impact of the diagnoses. Now, check back for part 3 as we explore some holistic approaches to managing herpes symptoms. Until then, toodles.